everyone, I'm my Katrina from BSN Montashman. So today I'll be demonstrating about the preparation of Ampule. Now, before we prepare the medication, we must first assess the patient. Assess the patient if he or she is experiencing allergies within the medication. And then tell the specific drug action, the side effects, the interaction, and adverse reactions of the medication. Now, check if the client has the knowledge about the medication, and if not, give the patient about the information in the medication. Now, check the intended route of parental medication to determine which is the right size of the syringe to be used. Now, we are going to check the ampule, the ordered ampule of the doctor, for the clarity and the expiration date. Now, we can see that the ampule is clear, and the expiration date is about 2023. So this means that the ampule can be consumable by this time. So the next thing that we are going to do is prepare the materials that we will be needing. So first is our client's MAR or the medication card. Next thing is our ampule. And then supposedly there will be a ampule opener, but now I failed to search here in our location. So I'll be using gauze for protection in opening it. Now the next thing is our syringe, and then our tissue for other instances that we'll be wiping the excess medication, and then our tray. Next thing is our alcohol for disinfecting our hands. Supposedly there will be a filter straw needle to be used in filtering the fragments of the bottle, but since we don't have a filter straw in the Philippines, we'll be doing it directly. Now that we have prepared the materials, now we are going to check the MAR of the patient. Now let's check if the ordered medication that is in the MAR is the same with the ampule that we have already get. So the ampule is paracetamol, and also let's check the right dosage that the doctors already intended to write in the MAR, the route, and also we must check if we are giving it in the right time and to the right patient. So the next thing that we are going to do is perform a hand hygiene. So since that I've already washed our hands, I'll be put some other prevention infection procedures like disinfecting my hands with the use of alcohol, and prepare the medication by pulling out the medication from the ampule. So there are instances that the medication are still in the cap of the bottle like this. So what we are going to do is to flick the bottle so that the medication will be slide down the bottle right there, as you can see. So there's no excess medication at the top. Now after that, we can use this tissue in wiping the neck to a, so we'll be flickering it until there will be no medication at the top. Now it's clear. Wipe it, wipe the neck. Now dispose properly the tissue. Now that we have already wiped, now that we have already cleaned the ampule, we'll be opening it. So in opening the ampule, let's make sure that we are using a gauze for our protection, and then put our thumb, wrap the gauze in the neck of the ampule for protection, and then use your thumb, put your thumb like this, then flick it away from you like that, and then dispose. Since we have already opened the ampule, we have already break the neck of the ampule, we'll be disposing this part in the sharp container. We have already opened the ampule, so we'll be getting the medication with the use of the injection or the syringe. So since that we don't have a filter straw, we'll be using it directly. So in getting the medication of the ampule, so in withdrawing the medication, we'll be putting the ampule in the flat surface and put the needle in the middle. The rationale is to prevent contamination since it is considered the side of the bottle as contaminated. Now that we have already withdrawn the medication, let's say that we are giving the medication about 1.5 ml. Now we're putting the cap of the syringe and then put it in our tray. Also label the syringe with the name of the medication and its route, along with the MAR. Now, as the ampule has no medication inside of it, now we are going to put it in a sharp container. Now that you have already done,